Prevent Blindness, Focus on Eye Health podcast with host Christopher Hord and guest Aidan Moore.
Greetings. Our guest today is Aidan Moore, the Executive Director of the Dry Eye Foundation. Aidan has also been part of the Aspect program, one of the Aspect cohorts, and is an advocate for awareness and for the treatment of people with this condition. Welcome to the podcast, Aidan.
Chris, thanks so much. As you said, my name's Aidan Moore. I'm the executive director and co-founder of the Dry Eye Foundation. We're a small nonprofit that's based in Paulsbo, Washington, and we serve patients around the world. Our work goes back about 20 years, and we officially incorporated as a nonprofit in 2018. Personally, I work on many of our programs, including community support, research, safety, and advocacy.
Okay, thank you. And now one of the things I'd like to discuss first is kind of the scope of the problem. It's one of those things that's a little hard to define. Almost everyone experiences dry eye, but only so many experience it so consistently or so severely that it becomes a medical syndrome. So could you tell us a little bit more about the condition and how many people are affected by it?
That's a great question to start out with. I'll just caveat this to begin and say I don't have dry eye myself, but I've been working with the community for about 10 years. And as you said, a lot of people are affected. And the estimates that we have range from 16 to 50 million people. So that's a really wide spread. Not everyone's diagnosed with dry eye. Not everyone sees a doctor about dry eye. But that 16 million number, those are about the people that are diagnosed, and then a smaller set of that will be the ones who have the severe symptoms. Those are the people that are coming to the foundation. There can be all sorts of causes, from the environment to lifestyle, surgeries, drugs, autoimmune condition, age, hormones, and more. For some people, it's a severe pain in their eyes, greediness, burning, light sensitivity. Other people have more like flare-ups at some points, or might just be aware of their eyes from time to time. People do experience those symptoms pretty frequently. People visit multiple doctors. They'll struggle to find treatments for a while, and a lot of the costs are pretty high for out-of-pocket drugs and procedures. And I think my last point here too is that the term dry eye doesn't really do it justice. There's a huge quality of life impact, mental health impact. And I've just heard from a lot of patients over the years. Some have been homebound. Many people give up driving at night. People have to adapt to like the wind or AC, reduce their time on screens or reading books, just the activities that they enjoy. And then in terms of depression and anxiety, those can definitely be affected by dry eye as well.
Thank you. Those are several excellent points to make. Now, as far as some of the things we've already touched on, the scope of it and the way it affects people, what sort of options? You mentioned that some of the treatments can be very expensive. What sort of options are available to people who are experiencing this sort of thing?
Absolutely. So there's a whole range. It might start with over-the-counter eye drops or warm compresses. Frequently, people do eyelid hygiene as well. So you might use like a lid wipe or a spray to make sure your eyelids are clean and that you're not, producing film that's going to cause more inflammation. People take supplements like omega-3. Then they might move on to one or more prescription eye drops or an FDA-approved drug for dry eye. There are specialty medical devices and prosthetics that you can use. And there are also in-office treatments, but sometimes these treatments aren't covered by insurance. And insurance coverage does vary significantly for treatments.
Okay, good to know. Now, another thing you mentioned that I'd like to circle back around to, you mentioned that you yourself do not experience dry eye. So I'm wondering what sort of led you, we always like to ask people a little bit about their journey, how they ended up where they are now.
Totally. It was a complete accident. I have a family friend who started the foundation. She and I started the foundation together. She also has a small business online where she sells dry eye products. So at one point, I approached her about working for that company. I started there in 2016. And then in 2018, we started the foundation together. And I feel like I just really connected with being able to speak to and listen to people and just see all the ways in which kind of dry eye isn't recognized in society, that sometimes people feel lonely with this or that they don't have options. And I've just found that being that voice that listens to people, takes them seriously, and is able to offer resources has just been hugely gratifying personally. So I feel like there's a lot of work still left to do in the space for dry eye.
Well, thank you. In your role as executive director, I understand that the organization has been pretty active as far as its advocacy work. Please tell us a little bit more about that.
Course. So July is Dry Eye Awareness Month. Dry
That's
Eye
correct.
Awareness Month has been commemorated for like 20 years now. We've done different activities, kind of marketing campaigns during Dry Eye Awareness Month. It was 2 years ago that the Alliance for Vision Research started inviting us to the Dry Eye Congressional Briefing. And then last year, we organized an Dry Eye Advocacy Day with the Alliance for Vision Research. So we brought 30 patients to DC. They talked about raising awareness about dry eye and a couple important points like, treatment access, federal research funding for dry eye treatments, and just product safety because we've seen a lot of eye drop recalls. So just making people aware, I think, of those stories of people who live with dry eye has been impactful for, the members of Congress and their staff so they can kind of connect real stories with the policy asks that we're making of them.
Fantastic. And that actually brings up naturally another topic. As we mentioned, you've been part of the Aspect program. And I, in fact, was a member of an Aspect cohort myself. So I always like to ask people a little bit about their experiences, what they thought, and to try to have them express, at least briefly from their point of view, what it meant to them to participate.
It was a hugely impactful experience for me. I think the community aspect was really strong, and I know we had a really fun and supportive cohort. We were the gumbo cohort, I think cohort 11. But I'll say my advocacy work, on the federal level has only been going on for less than a year. And I think planning our first advocacy day last year, there were some times where I was like, oh my gosh, are we going to be able to pull this off? Maybe we still have time to cancel. Are we going to be able to change anyone's mind? But once we got to DC, it really felt right. Patients were so excited to share their story and kind of make something positive out of, a rather negative life experience. They were standing up for other people, seeing their story in a new light, and I got to do the same on the Aspect program. I always struggle to say, like, I don't have dry eye, why are you working for the Dry Eye Foundation? What's your motivation? And I think writing my story helps me clarify that. I have other experiences in my life where I have struggled with mental health and have felt like I'm the only one. No one understands what I'm going through. And I think when we bring together people in a community, whatever those issues are, I think for dry eye, people do so much better when they have people to ask questions and they're like, I'm not the only one going through this. And maybe there's some tips and tricks that people have collected over the years that we're able to share. I just love being part of that program. I know that the staff that runs it is incredible, and I'd love to have more dry eye patients in the Aspect program so we can continue our advocacy.
All right. And now speaking about the population, the dry eye population, for folks who are listening and who are not familiar with the foundation, please give them a little information about the best ways that they can find out more information or reach out if they would like to try to contact you.
Absolutely, yeah. So I'll share our contact information. We have a phone number, 800-484-0244 is our dry eye helpline. Those calls usually ring through to me, and I'm available to, pick up the phone, figure out how we can help. I often refer people onto other services like our dry eye Zoom groups, or we can do a more in-depth helpline call with another patient advocate. We have Facebook groups. We have a free dry eye guidebook on our website. We have some informative, blog posts and educational resources. We have a YouTube channel with lots of recordings and webinars. So that's 800-484-0244, and our website is dryeyefoundation.org.
Excellent. And I'd like to tell our listeners that depending on where you get your podcasts, if you didn't catch that information, it will be in the show notes. So there should be a link in there that you will be able to use as well. Okay. So tell us a little bit about sort of what's in store. What sort of things is the foundation looking at or considering for upcoming projects or events or so forth?
Absolutely. So we're just in the middle of recruiting for our own Dry Eye Advocacy Day year two. We're going to be going from July 16 to 17. So I've been running some webinars and info sessions to get people, interested in joining. So if you have dry eye symptoms and if it's made a big impact on your life, we'll have a letter that you can sign on to share with your representatives about some of the changes you'd like to see, what you've been through. So that's a great way to support kind of awareness during Dry Eye Awareness Month. We're currently in the middle of a big eye drop recall. You can always follow updates at eyedropsafety.org. And we had some brand name eye drops that were recalled recently. So we take safety very seriously when we follow recalls and warning letters from the FDA. So that's another big thing, yeah, for us. The last thing I had notes on was on the mental health side. I think that's one of the biggest reasons for me that I'm in this work. I think sometimes people just don't know what they're in for and can't really see things getting better. But we found a lot of success, just helping people, giving them resources, offering them reassurance. And I've seen a lot of people get better over the years. I think when you start out, you don't really know what's going to happen. We like to talk about dry eye as a chronic pain condition. So it doesn't mean that things will never get better. It just means that we can use chronic pain strategies and understand that after kind of an acute phase, you might just be in a cycle of flare-ups and remission. So doctors oftentimes are able to treat signs of disease that they see, but patients can kind of be stuck dealing with the symptom relief by themselves. So we offer help with treatments and symptom relief like moisture chamber glasses that a lot of people don't know about. We can give advice on eye drops. So self-care is really important. And, people come to us when they're struggling. They might not think that things will get better. But I've seen a lot of people improve, find the treatments that work for them. It just takes a right amount of time. And I think there's a lot of reasons to hope. There's new treatments that are being developed. We go to conferences every year where we see the amount of money that's being put into research. So I like to help people just, figure out what the next step is so that they can continue, living with dry eye. And I think, yeah, on the mental health side, it's easy to just kind of assume the worst, but I've seen a lot of people get better, and we've talked in a lot of mental health conversations in our mental health support group, and just dealing with that depression and anxiety, I think is really, nobody wants to deal with it, but it can be better to deal with it in community too, and talk to other people who understand.
All right. An excellent point, Aidan. Thank you for sharing that.
Yeah, thank you.
Okay, so by and large, then I would just like to mention to our listeners, if you are experiencing dry eye on a regular basis or severe flare-ups, some people who are dealing with other eye conditions may not have thought of this as a separate individual thing. Now that you've heard Aidan, if you want to outreach to the foundation, we've got the information in the show notes. Please do reach out. Our guest again has been Aidan Moore, the Executive Director of the Dry Eye Foundation. Thank you so much for being a guest on the program, and thank you for the work you do, Aidan.
Thank you. Thanks for having me.
Thank you for tuning in to the Prevent Blindness Focus on Eye Health podcast. For more information, please visit preventblindness.org.